What our report continues to show is that the demand for physicians outstrips the supply, and that's based on looking at how medicine is practiced today, and then looking 10 years or more in the future and saying, what are the needs going to be in 2030? The principal driver of the shortage is the growth in the U.S. population, and we use U.S. Census data to state what the census is going to be in 2030. We also know that there's an aging of the population, and so about 10,000 individuals a day are turning 65 or older, and older adults, older American adults, see more physicians than younger individuals. So the demand is rising principally for those two reasons. There's a shortage of primary care doctors, and there's a shortage of specialists. I think when I first took a look, when I came to the AAMC, I, like many people in America, thought, oh, there's a primary care shortage, and that's what we need to address. And indeed there is. It's an important area. We need to continue to have primary care doctors. I think what I was surprised about is that there is as much, if not a slightly greater need for certain specialists. And I can point out a couple of areas where this is important for our communities. Behavioral health is one. There is a significant issue with opioid abuse, as well as depression and other psychiatric illnesses within our communities. And we need to have a very strong and very robust behavioral health physicians working with behavioral health social workers and psychologists. We also see that there's a shortage in general surgery as well as some surgical specialties. It's probably a combination of people who have retired from general surgery, but also the increased demand. So I don't want to underplay at all. There is a primary care shortage, but we also have to remember that there's a shortage of other specialists, and we need to be balanced in our approach. The impact of the doctor shortage on patient care is that individuals do not have access to physicians, and they do not have timely access. And so people will find that either they can't get in to see their primary care doctor when they need to or on a timely basis, or they may have to wait to be seen by a specialist. And so you'll see 3, 6, 8 weeks, maybe 12 weeks delay before you can see a specialist that you need. And so the consequence is either no access or delayed access, which can have a significant effect on the health of individuals. As a kidney specialist, I would tell you that there's an unmet need. There are always people who are waiting to get in to see me. And here was a woman who was about 18 weeks pregnant. She was severely hypertensive. She had the new onset of lupus. And I took a look at the note, I took a look at her, and I turned to my office and I said, we have to stay open, we have to see her, this is a medical emergency. And all I could think is, this is not how it should be. This is, it shouldn't be sitting out in the doctor's office with a note hoping that you'll catch someone's attention.